Hi everyone. Now we are going to discuss about human diseases caused by virus. Mainly we are going to discussing about rabies, measles, swine flu and AIDS. Let us see about rabies. The rabies, which is the one of the type of zoonotic disease, this rabies disease has been recognized from very ancient time as a disease that occurs primarily in animals and is transmitted to mammals and humans. It is an acute viral disease of central nervous system. The causative agent is rabies virus, a negative stranded RNA virus of rhabdovirus family. The rabies virus have a bullet-shaped structure and it contains many type of proteins such as M protein, N protein, G protein and L protein, P protein, etc. It have an envelope covering and it contain negatively stranded RNA is inside the virus. Then, the mode of transmission of rabies is mainly through the animal bite, licks, and person to person. The pathogenesis of rabies is an acute infection of central nervous system. Following inoculation, the virus replicates in striated or connective tissue at site of inoculation and enters the peripheral nerves through nervous muscular junction. It then spread to the central nervous system. Then, from this diagram, we can understand how a rabies virus that infect our body. When a virus enters via animal bite, then the virus replicates in muscles at site of bite. Then the virus infects nerves in peripheral nervous system, moves by retrograde transport. Then the virus replicates in dorsal root ganglion and travels up spinal cord to brain. Then the brain is fully infected with rabies. Then the virus travels from brain via nerves to other tissues such as eyes, kidneys, salivary glands. Then the incubation period of rabies virus, it is highly variable in man, commonly 3 to 8 weeks following exposure. The closer the bite to the brain, shorter the incubation. When the close to the biting site, that shorter the incubation period. The rabies virus travels 1 centimeter per day. The host and source of infection. The mammals are the natural hosts of rabies. All warm-blooded vertebrates, including man, are susceptible to rabies. The reservoirs consist of the carnivores, such as the dogs, cats, mongoose, and bats, etc. The source of infection to man is the saliva of rabid animals. In dog and cat, the virus may be present in the saliva for 3 to 4 days before the clinical onset and during the course of illness till death. The early signs of rabies is the fever, headache, weakness, and ashy muscles, and the late signs of rabies is the incoordination, confusion, and strange behavior, and the attacking and biting, moving at stationary objects, and salivation, and hydrophobia, photophobia, and aerophobia, and paralysis, seizures, and death within 2 weeks of showing signs. There are mainly two types of preventive measures: the pre-exposure prophylaxis and post-exposure prophylaxis. The pre-exposure prophylaxis provided to subject at site risk before occupational or vocational rabies. The subjects include diagnosticians, laboratory and vaccine workers, veterinarians and carers, etc. Simplifies the post-exposure management, and is the pre-exposure prophylaxis occurs is mainly through the vaccines, and the pre-exposure prophylaxis occurs mainly through the vaccines. Then the post-exposure prophylaxis. It is provided to subject after rabies exposure and consisting of wound care, rabies immune globulin and vaccine. The cleansing and chemical treatment and suturing and anti-rabies serum and antibiotic and anti-tetanus measures and observe the animal for 10 days. The rabies vaccines are the nervous tissue vaccine and duck embryo vaccine, for example, purified chick embryo cell, and the cell culture vaccine, the human diploid cell vaccine. Then let us see about the measles. The measles, it is an acute viral infection characterized by a final stage with a maculopapular rash erupting successively over the neck, face, tongue, arms and legs and accompanied by a high fever. It is caused by infection with rubella virus, a paramyxovirus of the genus morbillivirus. The mode of transmission of measles is mainly through the measles is an airborne disease. The virus spread easily through the coughs and sneezes. It may also spread through the contact with saliva or nasal secretion. The pathogenesis of measles, the infection is initiated when measles virus is deposited on epithelial cells in the respiratory tract, oropharynx or conjunctivae. During the first 2 to 4 days after infection, the measles virus proliferates locally in the respiratory mucosa and spread to the lymph nodes. Then the virus enters into the bloodstream in infected leukocytes, producing the primary viremia that disseminates infection throughout the reticuloendothelial system. Further replication results in secondary viremia that begins 5 to 7 days after infection and disseminates measles virus throughout the body. The main symptoms of measles is the fever, dry cough, coryza, sore throat and inflamed eyes. The tiny white spots with bluish white centers on a red background called the Koplik spots, and the skin rash, maculopapular rash. And the measles virus have 4 main phases are the and incubation period, prodromal period, exanthem period and recovalence period. Then we are already discussed about the symptoms of measles and the runny nose, cough and tiredness and sleepiness and loss of appetite, fever, sensitive to light and spot inside the mouth and conjunctivitis. The treatment for measles is there is no specific antiviral therapy for measles, and treatment consisting of general supportive measures such as the hydration, bed rest, administration of the antipyretic agents and vitamin A is effective for the treatment of measles and can markedly reducing the rates of morbidity and mortality. Then let us see about the swine flu or the H1N1. The swine influenza or swine flu is a respiratory disease of pig caused by type A influenza virus that cause regular outbreaks in pigs. The swine flu virus have been reported to spread from person to person, but in the past this transmission was limited and not sustained beyond 3 people. The main major differences between the swine flu and the human flu is the H1N1 swine flu virus are antigenically very different from human H1N1 virus, and therefore vaccine for human seasonal flu would not provide protection from H1N1 swine flu virus. The transmission of H1N1 is mainly through the spreading of the swine flu virus is thought to be happening in the same way that the seasonal flu spreads. But various international agencies such as the Center for Disease Control and Prevention and WHO have determined that this swine flu influenza A virus contagious and is spreading from human to human. The flu viruses are spread mainly from person to person through coughing or sneezing of people with influenza, and sometimes the pupil may become infected by touching something with live in flu virus on it and then touching their mouth or nose. The symptoms of H1N1 are the fever, sore throat, vomiting, diarrhea and running nose, coughing and nausea are all symptoms of swine flu in humans. The emergency warning signs in children are the fast breathing or trouble breathing and bluish skin color and not drinking enough fluids and being so irritable that a child does not want to be held and fever with a rash. The emergency warning signs in adults It is a difficulty to breathing or shortness of breath and pain or pressure in chest and abdomen and sudden dizziness and confusion and severe or persistent vomiting. Then the diagnosis of swine flu influenza A infection, a respiratory specimen would generally need to be collected within the first 4 to 5 days of illness. However, some persons, especially children, may shed virus for 10 days or longer. The identification as a swine flu virus requires sending the specimen to hospital laboratory for testing. Next, we are discussing about the viral disease AIDS. The AIDS that stands for acute immunodeficiency syndrome. The people with AIDS have weakened immune system that make them vulnerable to medical conditions and infections. Its incubation period is few months to 10 years. About 37.9 million people living with HIV, and HIV killed more than 25 million people. The major causes of HIV is the human immunodeficiency virus. If anybody get infected with HIV, his body will try to fight in the infection. Without drug treatment, the HIV infection usually progresses to AIDS in an average of 10 years. Someone who is malnutrition may well progress to AIDS and death more rapidly. The HIV virus is mainly of two types, the HIV virus 1 and the HIV virus 2. The structure is here. It have a lipid envelope on the outermost layer and receptor complexes are present on the outermost surface and structural proteins and enzymes and the single-stranded RNA is present inside the virus. The transmission is mainly through only the blood and semen have been conclusively shown to transmit virus. HIV is also found in blood, semen, CSF, breast milk, saliva, and tears and urine. The HIV is transmitted mainly through use of non-sterile syringes and tools and pregnancy and breastfeeding time and blood transfusion time and during the time of organ transplantation and the unprotected sex. It is not transmitting through the food, drink, utensils and insect bites, kiss, touch, clothes, towels and toilet or showers. The diagnosis is mainly through the recombinant DNA techniques and PCR and ELISA and viral isolation in culture and indirect tests are the lymph node biopsy and lymphopenia and CD4 counts. The prevention is mainly through the awareness about use of condoms and uses of shared needles, syringes and donors' blood should be screened for HIV and rehabilitation of HIV/AIDS cases and strict sterilization techniques in hospitals, clinics should be applied. The treatment is there is no cure treatment for AIDS. There are drugs that can slow down the AIDS virus and slow down the damage to your immune system. There is no way to clear HIV from the body. Thank you for watching this video.